This is actually a response video to my last video on best countries for IVF in honor of Black Maternal Health Week. So if you haven't seen it, I encourage you to check it out. I will put the link in the description, okay? I was asked by a number of you about the safest countries to deliver a baby, whether you were not using IVF methods or whether you were or you were not. So today we're actually going to discuss where Black women can go to safely deliver your baby or babies. First, if you're new to my channel, welcome. I'm Dr. Natasha Ramental, also known as the Medical Tourism RN. I'm not a physician. I am a doctoral trained registered nurse who's worked in the emergency department and post-anesthesia care unit for a number of years. So on my channel, I actually cover all aspects of medical tourism for Black women if they decide to seek healthcare or treatment abroad for things from anywhere ranging from cosmetic surgery to cancer or fertility treatment, in order for Black women to make the most informed decisions about their healthcare to have the best outcomes and experience. So if this is of interest to you, make sure you subscribe to my channel and hit the notification bell so you're notified when I post a video. All right. So what is used to determine where you can safely deliver your baby? There's two sets of data: countries with the lowest infant mortality rate and also countries with the lowest maternal mortality rate. And we're going to cover both. So infant mortality is the death of an infant before his or her first birthday. So the infant mortality rate is the number of infant deaths for every 1,000 live births. Okay. And the maternal mortality actually refers to deaths due to complications from pregnancy or childbirth. So a pregnancy related death is a death while pregnant or within 1 year of the end of pregnancy from any cause related to or aggravated by the pregnancy. All right. So, unfortunately, the US lags in both of these metrics. The US has the highest infant mortality rate and the highest maternal mortality rates of developed countries. So, the maternal mortality rate for non Hispanic Black women was 70 deaths per 100,000. So, Black women are more likely to die of pregnancy, about 3 times more likely to die of pregnancy related complications than white women. So each year in the US, hundreds of people die during pregnancy or in the year after. Now, thousands more have unexpected outcomes of labor and delivery with serious short or long term health consequences. So every pregnancy related death obviously is tragic, especially because more than 80% of pregnancy related deaths in the US are actually preventable. So, recognizing the urgent maternal warning signs, providing timely treatment, and also just delivering respectful, quality care can actually prevent many pregnancy related deaths. Now, the US will tell you the disparities in pregnant Black women is because of things like access to health care, whether they're uninsured or underinsured. But Dr. Natasha is going to always tell you the truth. Access issues exist, but they're a small part of the problem. Okay. In the US, it is because racial disparities exist. Black women, again, 3 times more likely to die of pregnancy related cause than white women. Multiple factors actually contribute to these disparities. Things like variation in quality health care, underlying chronic conditions, but also structural racism and implicit bias. All of that plays a role. Racial disparities exist. I was actually speaking with a young Black female OBGYN. She was in her late 20s, early 30s, who said her chances of a healthy pregnancy in the US were less than a poor white woman. So it's not all about the economics, okay? So don't be fooled. Healthy moms lead to greater chances of a healthy baby. So I'm actually going to start with the top 5 countries with the lowest infant mortality rate. Okay, and these figures are the latest ones, which are 2021. There's actually a list of top 20 countries, but in the interest of time, I am only going to cover the top 5, but I will list the full 20 countries in the description. Okay, so lowest infant mortality rate, number 1, Slovenia. And I'm going to be looking at my notes, guys. But Slovenia is among one of the safest countries in the world to give birth. It actually has one of the lowest cesarean section rates in Europe, although it's around 20% of all Slovenian births that are done via this method. So they support natural births. They also support water births. And if a C-section is done, unlike in the US, you are actually kept at the hospital for 8 to 10 days where you're monitored rather than being sent home after 2 days. Okay. And in the US, a typical birth by C section costs anywhere between $10,000 to $12,000 without insurance. In Slovenia, a natural delivery would be about $1,200, and a C section would be about $2,000 without insurance. There are some additional costs if you have things like a private room, but honestly, they're minor and would not take you even halfway to where you what you'd pay for the US. Okay. Number two, Singapore. So Singapore is an ideal destination because it's safe, it's clean. There's a lot to do to keep the entire family or whomever you take with you entertained. But in Singapore, hospitals in both the public and the private sectors are typically safe and very reliable. Deciding between both is generally just a matter of choice. Both systems deliver top of the line medical care. The extremely low infant mortality rates in Singapore actually verify the high quality of the medical systems in place. So it's not uncommon for pregnant visitors and non residents to give birth in Singapore. Actually, expats residing in Indonesia and other countries that are adjacent to Singapore often travel to Singapore for prenatal care. And in fact, the Singaporean government has streamlined the process of visitors coming to the country for such purposes. It's called maternity tourism. Okay. But during a normal vaginal birth, you can actually expect the process to happen quite naturally without any intervention. And it's really affordable. When we talk about just the pregnancy period, they have really affordable preconception testing, things like ultrasounds, pap smears, genetic testing, all of those things for the entire pregnancy will run you between 150 to 1100 US dollars. And that's for the entire period. And then you, again, can choose between public or private hospitals and whether you want a public or private gynecologist. If you decide to go with the public subsidized gynecologist, it'll run you anywhere from $21 to $29 US. And if you go with a private gynecologist who may be based at a government hospital, that can run you anywhere from 81 to 300 US dollars. Still a really great deal. As far as the delivery, the cost for a normal vaginal delivery at a government hospital ranges from $508 to just above $4,300. And for private hospitals, this actually starts at a little over $3,600 and goes as high as $9,700. And although cesarean births have become popular around the world, they are actually considered to be a major surgical procedure. And so that will cost you from about a little over $8,700 upwards to a little over $15,000. Okay. Number three, Iceland. So Iceland is actually home to about 326,000 people, and fewer than 5,000 babies are actually born there every year. So for decades, they've consistently had some of the best maternal health outcomes in the world. Icelandic women can deliver anywhere, at home, a birthing center, hospital, whatever you choose. Um, and Iceland has one of the lowest crime rates in the world. Their police don't even carry guns, and the locals look out for each other, making Iceland one of the best and safest places to visit while you are pregnant. Something to consider. But most births in Iceland today actually take place in a healthcare setting. So, although home births have become much more frequent in recent years, hospitals are still, on par in terms of numbers. One of the things about Iceland is that they've actually ranked number one in the World Economic Forum's Global Gender Gap Report every year since 2009. And I thought this was important because women are actually well represented in politics and the workplace and in healthcare. And so healthcare aren't political issues in Iceland. They have universal health care, generous pre and postnatal care programs, midwifery run maternity units, and integrated options for home deliveries. So obstetricians actually handle complications, but overall, the midwives are running the show and their outcomes are excellent. So their midwife run maternal health system supports women's choices and normal physiological birth. They offer a full spectrum of care, including things like pain management options. They also avoid unnecessary interventions. So this is really great. As far as cost, there's no charge um, for labor and delivery as long as the patient is insured by the Icelandic National Health Insurance System. So you may choose to give birth at any healthcare facility that actually offers obstetric services. And inpatient treatment is free of cost, unheard of here in the US. But the universal healthcare system provides healthcare free of charge to everyone, including the unemployed, old, the elderly, and otherwise challenged if they are admitted to hospitals. Okay. How much does health insurance cost in Iceland? The healthcare spending for these are 2019 numbers, but total healthcare spending was around 6,200 US dollars total for the year. So I think that's great. One fun fact I wanted to share with you about Iceland is that um, they've been strong on women's rights since like the mid 19th century, but Icelanders say that women's status in society actually took a big step forward back in the 70s. They said that that's when 90% of Icelandic women actually walked off the job and out of their homes to demonstrate for equal rights. So they brought the nation to a standstill and then rapidly accelerated public policy to better represent women. And actually, within months, progressive reproductive, maternal health, and maternity leave laws were then passed. Okay. And then 5 years later, they elected a divorced single mother as president of Iceland, making her the first woman in the world to be democratically elected as head of state. So I think that's amazing. Number four, Monaco. So Monaco has extremely low infant mortality rate. It's actually one death per 1,000 births. Okay. Monaco's standard of living, though, is extremely high across the board with everyone. Okay. They provide excellent maternity and infant care, and women are actually guaranteed several months of maternity leave. And there are high quality, low cost daycare centers and nurseries that are also available to them. So the national health and education programs ensure that the families in Monaco have complete early childhood support and care. And they actually offer excellent public education um, with high quality, low cost education and healthcare from infancy all the way up to adolescence for free. Okay. Now, Monaco's small size, they have a very unique history, and again, a high standard of living. That's helped them avoid many of the child social problems that are faced in larger countries like teen pregnancy, etc. Okay. So, as an expectant expat in Monaco, you have a variety of options when it comes to maternity care. If you're registered with the National Healthcare Scheme, you'll actually be able to access public maternity care. You'll also be able to have your baby with a private healthcare provider if you choose. If you choose to do that, you will have to have a policy that actually covers maternity provision. And then all mothers have a birth plan, which is a list of what you'd like to happen in labor and beyond. It's written so that your doctor knows what your wishes and your expectations might be. You know, where do you want to deliver? What type of who do you want to have with you? What kind of birth do you want? Vaginal, C-section, any birthing aids, pain relief, and things of that nature. Okay, so you'll be able to discuss this plan with the public or private hospital of your choice in Monaco. You'll also be eligible for maternity allowance under their laws. Monaco actually permits 16 weeks of maternity leave with 26 weeks for your third child, and it's actually calculated on a daily basis. Paternity leave is also available in Monaco, and if you're employed in Monaco, your job must keep the job open. And once your maternity leave ends, you may choose to leave work, or you can go part time, in which case you'll be entitled to even further payment up until the child's third birthday. So that's a plus. And if you have more than one child and have worked for 2 out of the 5 previous years in Monaco, you will be eligible for another type of parental allowance. Okay. And it's also important to note that in Monaco, adoption benefits are also allowable under certain circumstances. All right, number 5, Japan. Japan has one of the lowest infant mortality rates in the world as well. What I will tell you is that it's extremely economical. And I don't know if a lot of people would have thought so, but it's extremely economical to have your child in Japan as well as it being safe. But on average, you can expect to pay between 3,000 to 4,000 US dollars for a single birth. However, the government provides a subsidy that's worth 2,800 US dollars, which will cover most of the cost. Okay. So if you want an epidural in Japan, you will usually need to pay another 600 US dollars out of pocket. General hospitals do not typically offer epidurals for birth. It's still very rare for Japanese women to get an epidural. So, getting induced, staying at the hospital for extra days, getting a C section, or staying in fancier birthing clinics will actually set you back a little bit further as well. But if you think about it, I'll share that hospital admission fee in Japan, birthing fee, new baby care, tests and medicine, treatment, obstetrician, and anything other, maybe complications, cerebral palsy, all these other things. All of these things will still cost you a little over $1,100 US dollars in Japan. So, I mean, you can't beat that. Okay. So, those are the lowest infant mortality. Let's get into the countries with the lowest maternal mortality rates. So, countries in which women today have the lowest risk to die from pregnancy related causes, number one, Finland. And ironically, Finland was number six in the lowest infant mortality. But the Finnish maternal mortality rate is anywhere from 3 deaths per 100,000 live births, compared to the US numbers, which is 19 deaths per 100 live births in that same year. So Finland consistently ranks as one of the safest places to be pregnant and to give birth, and it's also recognized for its innovations in maternal care. So maternity and child health clinic services play a vital role in Finland. Their first maternity and child health clinics were established in the 1920s, and they enacted legislation that charged basically local authorities with the responsibility to provide maternity and child health clinic services as part of primary health care, which is amazing. So, clinic services include things like regular health exams at predetermined times, also health counseling, and then they give regular monitoring that helps prevent illnesses and identify risks at an early age or early stage, excuse me. And the clinics also offer guidance and support to those who need them. So even today, maternity and child care clinic services are offered to all families, regardless of socioeconomic status. And the services are universally popular. So according to the Finnish Medical Birth Registry, um, almost all pregnant women in Finland use maternity clinic services, over 99%, 99.6%. And that was as of 2014. So, of those who do not use the public sector services, some use private services, and the percentage of women who use no services is actually extremely small. Okay. So, what they actually do in Finland is they actually survey whether women use or the public services or not, and whether or not they need special support. And if so, they get provided to them. It's customized support for those who need it. So, those pregnant women are offered. Are actually referred to maternity outpatient clinics if it's necessary. And nearly all babies are actually delivered at hospitals there. And then the care that's given to premature babies there is of high quality, high standard, and everyone in Finland has access to high quality healthcare services and guidance. All right. Number two, Greece. Greece's maternal mortality ratio remained really stable around 3 deaths per 100,000 live births. So in Greece, it's one of the lowest in the world. And in 2010, they were actually tied with Singapore for the second safest place in the world to give birth, and that was by the World Health Organization. Obviously, this is a phenomenal accomplishment, but the rates have been low for quite some time, and they continued over the last 20 years. It's continued to even reduce their levels. Okay, and they're especially when it comes to any preventable maternal death at all in Greece. So that's something that I find to be comforting. But Greece spends considerable resources on general maternal health programs and prevention efforts. So much of the improvement over the years has actually been attributed to things like increasing socioeconomic status. But honestly, that's only partially true. Even in economic hard times, which Greece has experienced quite a bit, they've done very well regarding maternal health. And it appears that during good times, the government actually invested in resources which help protect the vulnerable during times of crisis. For instance, they actually established specialized prenatal care departments that added preventative controls for like high risk pregnancies, and they actually improved the transfer system for concerning mothers and newborn children. All right. So, number three, Norway. Norway has been among the lowest mortality, maternal mortality rates, with 2 deaths per 100,000 births. And they've been on the list in the top five for several decades. All right. This is likely to be associated with a couple things, but generally, they actually have very accessible antenatal care. It's free of charge and it's effective in identification of high risk pregnancies, combined with access to emergency obstetric care for all, right? In these high resource societies, obviously, this is something that's accessible. But Norway experienced a decrease in maternal mortality and a substantial increase in the number of health personnel. Essentially, the increase in the number of midwives is actually associated with a large decrease in maternal mortality in rural areas. So while there was a socioeconomic component in maternal mortality, economic development obviously was not like the key driving factor that reduced maternal mortality. There actually seems to be a strong connection between the main driver being the fall in maternal mortality being due to the increased access to health personnel and increased quality of services as well. So the role of knowledge about sanitation has also played a role. So there was a massive impact on maternal mortality in hospitals with regard to infection rates, and it actually played a role for women giving birth at home. So midwives that were also tending to women at home used their knowledge and expertise on infection control, sanitation issues to help have a safer delivery at home, contributing to a low maternal mortality rate as well. All right, number four, Poland. Poland has one of the lowest maternal mortality rates in the world, which experts have actually attributed to the general overall health status of Polish women and also national guidelines for how to care for pregnant women. But also, midwives play a significant role in childbirth in Poland. So, there are national guidelines for how to care for pregnant women, and putting midwives in hospitals have actually helped Polish women stay alive during and after childbirth. So the midwives in Poland are actually extremely independent. Their role is independent, where they're the first to see a pregnant woman when they walk in. They run maternity wards overnight, and they actually report to the doctors in the morning. So in Europe, it is common for midwives to care for pregnant women, but Polish midwives can actually practice independently without a doctor overseeing them. They can prescribe medication and act on their own if a woman has a medical emergency. Also, unlike in the US, where lack of insurance makes it harder for women to access prenatal care and control maybe chronic health issues like diabetes or high blood pressure, which increases the risk for pregnancy complications and death, in Poland, citizens actually pay into the country's national health fund, which provides nearly universal public health care. 91% of Polish people are insured. So the government also provides coverage for uninsured women during pregnancy, childbirth, and the postpartum period. And it gives parents of two or more children about $130 per month per child. And the low income parents actually receive an allowance for their first child. And after 21 weeks of pregnancy, women can actually have access to a midwife without paying out of pocket. In addition, every woman, regardless of insurance status, gets a home visit from a midwife within days of giving birth to check on her and her newborn. All right, number five, Iceland. This is the last one. Maternal mortality in Iceland is low. It's between 5 and 6 deaths for every 100,000 births. But a comprehensive national healthcare system with accessible antenatal care in a society with good general living conditions and universal education has been listed as attributing to this. But highly developed resources, universal healthcare, access to contraceptives, lower birth rate, and also almost a non existent teen pregnancy all contribute to the very low maternal mortality rate in Iceland. So there's a number of contributing factors, but these benefits actually there's extensive prenatal care at least 6 months duration in that's offered to all women, and these benefits include about 10 healthcare visits prior to birth by a range of healthcare professionals. So if the pregnancy is high risk, the mother will be allowed to remain in the hospital for several days for more constant monitoring. And unlike the healthcare system of several other highly developed countries like the US, the Icelandic system has not become as overly medicalized, so it's very holistic in nature. Only 17% of all mothers have a C section. And midwives and home births are actively encouraged and supported throughout the entire process. So I think that's really great, especially for those who want that. But to help the family after birth, there's an extensive family leave support system for the mother, child, and the partner. So at home, healthcare professional visits time, they basically have time off for both the mother and the partner, as well as child benefits. They come and visit. But there's a program to help compensate parents for the additional expense of a child. All of this contributed to lower stress levels and the ability to fully recover, which is what every mother deserves and needs after having a baby or babies. Okay, so these are the safest countries to have a baby. Now, I know there's a lot to consider when thinking about where you choose to spend your pregnancy or only to deliver. So, to help Black women out, I actually suggest you watch Stephanie Perry's Worst Countries for Black Travelers, Black Women Abroad. I will put the link in the description below. And she has another one, Countries Where Black Travelers Feel Welcome. And I will also link that description below. So both videos provide great insight on how Black women are treated in other countries, and it can help you narrow down your decision on which country to have your baby in. So I hope this was helpful. And until next time, be well.